Um, just pulling up my screen. All right, you guys can see my slides. Okay, beautiful. So what do I mean by secondary trauma? Some people call it vicarious trauma. And the American Counseling Association defines it as the emotional residue from working with people, hearing their trauma stories, and becoming witnesses to the pain, fear, and terror that trauma survivors have endured. When I talk about trauma here, I am going to be talking even more generally about things that we maybe I'm a psychologist, so we diagnose trauma in a very small way, right? So we diagnose it based on, have you experienced these things? And if you have experienced something else and you're experiencing trauma symptoms, then we wouldn't diagnose trauma. But trauma, little t, can mean a lot of different things. It can mean the experience of going through a crisis in the world, locally, or just personally that really impacts you in profound ways. A lot of the organizations that we work with through the Children's Trust, through healthcare, through other nonprofit organizations, we end up rubbing shoulders with other people who've experienced trauma, little t, right? Because they have gone through adverse experiences in their lives, or because they've actually experienced something that they might develop PTSD from. So there's a lot of different reasons why the people that we work with might have experienced trauma, and it doesn't have to amount to PTSD for us to experience secondary or vicarious trauma as a result of it. So when we have interactions with people who've experienced trauma, that trauma changes the way that they think about and view the world, themselves, and other people. And so, in a vicarious way, it can also start to impact how you experience the world, yourself, and others. So, we're going to talk through some of the ways that it can start to do that, and then some of the ways that we can try to combat that, whether you even realize you're experiencing it or not, or you just know you're working with these populations and you can do some specific things to try to prevent a secondary trauma reaction. So people who've experienced trauma often question their own identity, their role in life, in their family, in their organization, and their self-worth. So if you're working with families or in the community, if you're working with anyone who's experienced trauma, you might think if you're competent enough to do that work, if you're starting to experience some of that secondary trauma. Engaging with clients' traumatic material, whether that's what they're saying, what they're doing, it can interfere with your ability to be involved with your own life experiences too. And we'll talk about kind of different ways that that might happen. Your view of the world and your own values can change by interacting with trauma. Some people might have originally thought, there's good in the world, and then they might start changing to think that people are just cruel and unkind to each other. You might learn that trust was violated for your patients, the families that you work with, your clients, and you might find it hard to feel like other people are trustworthy. I work with children, so sometimes finding that parents have violated their children's trust can make it hard for some of us to feel like people are trustworthy, because a parent is someone you would expect to be trustworthy for a child. Sometimes you might feel a lack of control or power in the patient's stories. And then because of that, you might feel like you want to gain control over other things in your life that would be maybe okay letting go of control. Or you might feel a need to control the client's recovery. So if you have someone in front of you who, grief and trauma are a complicated recovery. There's ups and downs. There's 2 steps forward, 1 step back, or 1 step forward, 2 steps back. And it can be tempting when you're experiencing secondary trauma reactions to want to get that person further along. And they may not be ready for that. It can be tempting to have some emotional engagement in the lives of patients in an effort to help them heal. So that may be becoming overly friendly with someone that you're usually just a client, or usually just either a therapist or someone who's helping them work on their taxes, depending on what you're doing in your organization. Sometimes it also means that emotionally, a lot of your emotional energy is invested in that person, thinking about them, caring about them outside of work, thinking more about them. And that takes away your emotional energy from your ability to do other things and your ability to recover at the end of the day. It's also kind of along the same lines, more difficult to maintain those boundaries when you're experiencing secondary trauma. It's a lot harder to leave your work at home because your nervous system is a little afraid. So sometimes I use a little bit of humor to help convey my point. The idea behind this picture is that a lot of us, especially when we're doing hard work in the community for people that we know really need it, have a tendency, and sometimes it's a larger culture of trying to ignore the fires around us and saying like, this is fine, I'm fine, I can handle it. But when we actually just accept that when we hold another person's trauma, it will affect us, then it actually helps us to start to recognize these symptoms of secondary trauma that are coming up and to proactively do something about it. When we try to tell ourselves and other people, this is fine, I'm good, everything's fine, even though I just heard a horrible story from a patient, it gets a lot harder to actually acknowledge for yourself that you may be feeling some feelings of secondary trauma. So what are some of those symptoms that we might see? We talked a little bit about some of the thoughts that we might have or some beliefs about the world, ourselves, and other people. We might also have some free-floating anger or irritation. So the idea being like you're just irritable at other people. Maybe you snap at someone and you don't understand why. Sometimes people will have difficulty falling asleep or staying asleep. Some people will worry that they're not doing enough for the people they're working with, right? So in your organization, maybe you're the person who connects families to resources, but maybe you're also just the person who does intake and says, like, I'm going to put you on a waiting list. And that can feel like, well, this family is telling me they've got all this stuff going on, and all I can do is tell them that they have to wait. So that can feel really heavy that you're holding that. Sometimes you can feel a diminished joy for things that used to be enjoyable, and that's kind of the exhaustion that starts to come up too. So I say by a therapist, but I realize some people are not therapists. But you may feel trapped by the work that you do. You can feel trapped in a lot of different ways too. So it's not just like someone's forcing you to do that work. Some people feel trapped because they need the work. Some people also feel trapped for different reasons, like I spent a lot of time on this degree, so how could I do anything else? And some people also feel trapped because they feel like the people around me clearly need me to do this work. And so like who else will do it? We'll start talking about some of those questions we ask ourselves too that make it harder to see flexibility or a different outcome. Sometimes when you feel trapped, you also start to feel diminished feelings of satisfaction and personal accomplishment because it's less of your choice that you're doing what you're doing and more of this feeling of I have to. Some people will start to feel feelings of hopelessness associated with their work or clients. That can happen in a lot of different ways, right? So if you feel like you are responsible for helping them and you aren't doing enough, it can start to feel like you can never do enough. And then that's a very hopeless place to be. Overwork is actually a sign that we're experiencing secondary trauma as well. Sometimes that's because we're overworking instead of processing what we're experiencing or going through. And then sometimes people will see a change in their relationships with their colleagues as well. Okay, so we're going to go through this book called Trauma Stewardship is called An Everyday Guide to Caring for Self While You're Caring for Others. And it's a really good guide for those who work with people in the community who are underserved or in need or going through a lot of little t trauma, right? Also, many of the things in the system that we live in are traumatizing for families. Immigration is traumatizing, homelessness, being at risk of eviction, being at risk of losing your job, being low income. So all of these things are little t trauma that the families are going through that come through our organizations. And so we're getting that emotional residue all the time. So the question is, what do we do with that? We're going to talk about what we do with it in a second. First, we're going to go through kind of things that you might see in yourself or see in other people that you may notice are a part of a secondary trauma reaction. So as we go through them, check in with yourself. Do any of these feel true or accurate for you? But also, do you feel any other emotions as we go through them? So I will say I work with patients all the time. So there were definitely some feelings for me as I read these the first time of a little defensiveness, like actually what you're describing helps me do the work that I do. So just notice that emotion as it comes up. Do you feel scared? Do you feel worried? Or do you feel defensive? Or like, that's not a trauma reaction when I'm going through it. So just notice those things. Feel free to add them in the chat if you feel like it, or just notice them for yourself. And then as we go into kind of what we're going to do with these, you can think through kind of maybe why they might have been coming up too. So the first one that we want to think about is a lot of times when we have a lot of exposure to trauma, we might start feeling more helpless or hopeless in a variety of ways. One is that just families you families you see might be facing crises you can't do anything about. You can help connect them with other resources, but for example, I thought back to COVID. I can't change a global pandemic. I can't make your job hire you back because so many jobs were laying people off during that. So there's so many things that we can't change as individual people. We can advocate, we can lobby, but we can't change illnesses. So focusing on that helplessness is where the secondary trauma comes in. When we focus specifically on how helpless we are and the areas that we can't do anything about is where that secondary trauma kind of sinks in further. Thinking things like, will what I ever do make a difference? And I think you can kind of think a little bit about where we might go instead of that, but we'll talk more about in a second. So the second one here is an idea that you can never do enough. One of the quotes from the book was focused on, as a woman, what we experience societally about what you need to give other people and what you owe other people. So that there's a lot society tells us about what you should be doing instead of taking care of yourself, maybe even. So like being born and raised female, I internalized social messages that taught me that if I nurture others enough, if I care enough, if I anticipate others' needs enough, then everything will be okay. And you may have a feeling that given given the helpless and hopeless feelings that I talked about here, that you couldn't ever do enough to fix COVID. It's true. But focusing on how much everything you do is insufficient is another way that secondary trauma sinks in further. A common thought is also, if I don't do it, it's not going to get done. I totally feel that. This was one that resonated the most with me, especially in some of our agencies. We all wear a lot of different hats. And so sometimes the reality is that's probably true. But the question is, what do you do with that? Is the question, I'm going to just overwork and work harder because I have to do that? Or are you going to think about what are the things that truly need to be done in this moment? So the mentality behind this step of trauma stewardship is that what you do will never be enough to decrease the pain of others. That's that mentality. And so the conclusion is you just never stop doing it. You never stop working. You never stop pushing. But at some point, our bodies can't sustain that. Often, one of the things that is most insidious about this one is that we have a personal belief we're not doing enough, maybe because of how we were socialized, maybe because of how generous we were growing up and how much positive feedback we got about that. Then that collides with this professional messaging that we're not doing enough. So there might be colleagues that model that say the same thing. I'm not doing enough. I have to do more. And then this culture of hurry that we live in the US. And so that can combine all together and make us feel overwhelmed and exhausted, but also that feeling of never enoughness. Number 3 is something we call hypervigilance. This takes some different forms. If you've ever worked with capital T trauma, then you've heard of hypervigilance. It's kind of this feeling like our nervous systems got a shock from the trauma and then never really recovered. So we're kind of just raw, and our nerves are raw and on guard all the time. And that can happen when you've been exposed to other people's trauma. So what happens is we're so focused on our jobs that then sometimes we start looking for threats in places where there are none because we've witnessed such threatening, traumatic circumstances. So, for example, I know some doctors that when they're traveling, if someone stumbles or coughs, they think someone's choking because they're always used to the worst case scenario medically. And so they feel like they need to intervene constantly because they can't turn off their on guard brain. That's hypervigilance. It might be that if you work in a domestic violence shelter, you may see abuse in relationships that are not abusive because you're looking for signs that you've seen in relationships that are abusive, and your brain can't turn off that threat. Our tendencies towards hypervigilance are sometimes also extra reinforced by access to modern technology. So that increases the expectation that we're always reachable and always on. Think about if you respond to crises in the work and you hear your phone buzz, what does your body do? Does your heart start racing faster? Do you immediately go to check and see what it is? That's a form of hypervigilance because your body can't totally be calm. It's always ready to respond to that immediate need. Some people also describe that they can't really do things in a mindful, peaceful way because there's always this urgent need to do the next thing. And imagine how exhausted we're going to be if we operate like that. Number 4 is we might have some diminished creativity. So what does that mean? It means that the things that you may have done before that you felt were expanding your mind are harder to do now. So you might just work, go home, watch TV, go to sleep. You don't do those additional things that help you to expand beyond what you're doing at work. And so then work becomes much bigger, and the secondary trauma you're experiencing in that context becomes bigger too. So it also in the workplace or even with families, because we're so mentally exhausted, we just go through the paces of what we're supposed to do. So there's no point at which you're like, well, why do we do it this way? Maybe it would be more effective to do it a different way. And thinking creatively and flexibly together to even better the services for families and also the way that you're functioning in that setting, there's just not that flexibility to think differently or innovate because your brain is so tired. Number 5 is that we have this difficulty embracing complexity too. So what that means is in most little t trauma situations, it's very complex, right? So if we're dealing with a family on the verge of eviction, for example, that could have the parents could have full-time jobs or they could not. Maybe one parent lost a job recently, maybe they separated for some reason, there's substance abuse, maybe not, maybe there's the rent increased by 600%, which has happened in some places. So when you have a hard time embracing complexity, usually people become lumped together in a group. This is kind of where we get discrimination sometimes. If you've been through if you've worked in a place where you're working with families in the same sort of challenging situation for a while, for example, I work with parenting specifically. So sometimes I'll hear things like, I just don't think they want to change, or I just don't think they're willing to try. So we give simple explanations for things that are complex because it's mentally easier. And your brain doesn't have the space to see the complexity when you're overwhelmed and you're experiencing all of this unprocessed secondary trauma. So you really crave clear signs of good, bad, right, and wrong. You feel this urgent need to decide this is a good one, this is a bad one, whatever that means. So pay attention if you hear yourself making comments like, I really love the mom I'm working with, but I don't like the dad. You're separating into, I feel this way about this one, and that's how I'm just going to stick with it, versus understanding the complexity so that we don't pass judgments and make assumptions. Number 6 that we do is when we're experiencing this secondary trauma reaction is minimizing. And this is what happens when you've seen or heard about or even experienced such intense traumatic events that you start to categorize things subconsciously and then consciously into things that are worth a traumatic reaction and things that are not worth one. Basically, sometimes we see things that are so horrific or hear about them that then it's harder to see the trauma and the hurt and the pain that another person is experiencing because of how intense that one experience was. So instead, we trivialize the situation in front of us by comparing it to another situation. If you've ever heard, there's a saying that you can drown in 2 inches of water or the ocean. So the idea is if you drown in 2 inches of water and someone tells you, well, it wasn't the ocean, that's minimizing because you still experienced the same horrible experience. It just looked differently. So This can sometimes affect your work life in terms of having a hard time being empathetic to a family or a colleague who's experienced something that's not as extreme as something else you've seen. It can affect the way that you respond to yourself. So if you got in a car accident on the way to work, that sucks. But you might think, well, I didn't get shot, so I don't have anything to complain about because you've seen worse. But then that doesn't allow you to have compassion for yourself either. It can also cause a lot of distress in our personal lives. Sometimes it's hard to show up for the everyday stresses of people you love if you've seen people who don't have a job and don't have a home, because it doesn't look as significant compared to that, but it doesn't mean the other person isn't struggling. Number 7 is that I talked about exhaustion already, but here we're going to talk a little bit about more how intense the exhaustion can start to be when you are experiencing secondary trauma. So one of the quotes I liked a lot that I feel really captured the essence of this exhaustion is, it's a bone tired, soul tired, heart tired kind of exhaustion. It's not like after you've had a really tiring day or didn't sleep well. It's really like you feel it in your heart because of all of the things that you've heard about, seen, experienced. And it really kind of goes together with this realization of the overwhelming need and pain in the world and our relative ineffectiveness to mitigate it. That's difficult to cope with, that we just have a hard time coping with the fact that there is a lot in the world that's needed, and we are one person who's able, and we can do what we can do, but we can't solve the whole world's problems. And that exhaustion of being aware of those things that need to be addressed and being just one person is really tough, especially like I described, when your nerves are extra raw from the secondary trauma that you're experiencing. One thing that contributes to this fatigue is that belief I talked about, that we don't have any choice in the work that we do. So that can occur in a lot of different ways. But when we start to feel like I'm stuck here, that's when the exhaustion can get worse. Office culture can sometimes perpetuate this exhaustion because there's just this feeling, some places there's a feeling like people who are optimistic or energetic are just young and naive and they haven't really experienced the world yet. And then people who've been in that position for longer may have that like world weary perspective that I've seen it all. But sometimes that can really be like a jaded perspective of this exhaustion that's coming from secondary trauma that's not recognized and not dealt with. We also may try to avoid crashing and burning so hard that we work extra hard, because if you slow down and start to notice what's going on in your body, that may be when your body starts to tell you, uh-oh, there's some stuff we got to address. Number 8 is a really difficulty listening or really hearing what other people are telling you. And also sometimes this deliberate avoidance. So deliberate avoidance may not feel like you're making a decision to ignore what other people are asking for or needing, but it's just this action of really trying not to engage as much as possible. So one of the things I thought was helpful to think about this is if the highlight of your workday is when you don't have to do your job. For example, someone you had a meeting with cancels. Sometimes that feels good. But if that's the best part of your workday most days, that might be a sign that you're feeling tired. Avoidance can then sometimes start to leak into our personal lives. So you might choose not to answer your phone. You might go out with people less and less. Your personal life may itself start to feel overwhelming. So think about, are there things you avoid at work, at home? Do you not answer the phone right away? But is that because it might be someone might need you, might need something from you, might need you to do something, might need to even just talk and tell you more things that you don't have the space to hear in that moment? Do you not answer emails even though you have time? Kind of find yourself doing other things instead of answering emails? Do you feel excited or even hope families will cancel their sessions, or that any your colleagues will cancel meetings with you? Number 9 is that we have some dissociative moments. The language here sounds a little bit more intense than what it feels like in the moment. Some people will describe this as just being zoned out. We actually have moments like this throughout our day, especially if your mind is cluttered with a lot of different things. So basically, you might be engaged in your work, and you might even be having a conversation or be in a meeting or be in a training, I will say. And you may realize that you haven't heard the last 5 sentences that happened. That totally happens. You may be thinking about your grocery list, etc. But here, where it shows up in secondary trauma, is where you might be remembering something else that happened, and you may feel like you didn't bring out that memory. Something maybe reminded you of it, or your brain keeps going back to it because you're having a hard time processing it. So these occurrences become the most problematic when we plow through them or pretend I'm not having it. Like a thought keeps coming up, maybe about a patient, um, maybe about a family that you worked with, maybe about a story you heard earlier, and you just pretend, oh, I'm not having that over and over again. What we have to do instead is notice it. If it's not a good time to notice it, try to come back to it later. Try not to isolate, meaning if there are people you feel comfortable telling you or telling, gosh, this keeps coming up in my brain, and then seek out the support you need. That looks different to everyone. So that might be a friend, that might be a family member, that might be a therapist, but just seeking out someone that you can also divulge, like, these things are hard for me right now. Number 10 is that we might develop, they call it a sense of persecution in the book. The idea is here, we're taking things personally that are not personal, or that the sender did not make personal. So ways this might show up if you're working with patients or clients is if someone maybe doesn't do their homework, doesn't fill out their paperwork, doesn't return a phone call. And then how that's internalized is they don't respect me, they don't respect my time. And this kind of plays into what I had talked about earlier too, with that difficulty seeing the complexity, that we're not seeing all of those other reasons why that person might not return a phone call or show up or do their homework. We're just feeling like it's because they don't respect me. You might be assigned a new task at work, and you could think it's because you're a hard, passionate worker and you're really good at getting things done. But you could also see it as someone handing it to you because you're a pushover and you're going to do it. Depends on how you perceive it. Secondary trauma makes it more likely that we take it personally in a negative way, because secondary trauma is just wearing away at our defenses. So then this sense of persecution naturally starts to give us this profound feeling that we don't have control over our lives. Because if someone else is making the decisions about when to show up, what work we're getting, someone else is deciding everything about our lives. And then there's sometimes this feeling for individuals, organizations to feel like they don't have the power or control in the situation, and then they don't take power in places where they may actually have it. They kind of like start to let things happen to them. For example, instead of speaking up about funding being removed, they let it occur. The challenge is that if you look for powerlessness in any situation, you can find it. So any situation that's frustrating, you can find places where you don't have power. So when we focus on it, then it becomes greater and greater. Because if you feel like you have no power, you try less and less to look for that power. The good part is that if you look for a sense of self-efficacy, you can find that too, even in most circumstances. It may not be a big piece of control that you have, but if you get to make the decision in certain places, and we'll talk about more how to do this in a second, it can help you feel like you have a little bit more control. And the more steps you take in that direction, the more it feels less like ambiguous situations are someone trying to push you around. I'm going to get into a couple of emotions we're going to feel during secondary trauma. So guilt is our first one. So guilt can come up when you're hearing about all of these stories or even witnessing trauma that's happening. You might not be doing it, but we can get really uncomfortable about the difference between our lives and the lives of people that we encounter at your work or in other contexts. So some of the descriptions that came from the book were, for example, someone working in a homeless shelter mentioned that they just felt guilty because they had a home to go to at the end of the day. So they kind of held with them that guilty feeling. Guilt can also come up when we sit with this feeling of like, how do we live in a world where there's such a disparity of resources between those who have and those who don't? What can we possibly do one-on-one to neutralize or to make those imbalances different? And how can we cope with that, enjoy our lives, and not just be stuck in our guilt? The challenge is guilt really makes us stuck. It interrupts our ability to actually be in the present moment because we're so stuck in our heads thinking about all the things that we did wrong, all the things we should do. And it also doesn't let us actually absorb the goodness in our lives. Because this person, imagine how grateful their ability to feel gratitude that they have a home to go to is probably overshadowed by that feeling of guilt that other people don't. And so then the challenge is they can't actually absorb the positive that's existing in their lives so they can be consistently present for those families that they're working with. So if we're going to be present for life suffering, which many of us are, we do need all the nourishment and rejuvenation that comes from the beauty in our lives. And that's just so hard to access when we're stuck in guilt. Fear is another emotion that commonly comes up when we are a witness to other people's trauma. So that can come in a lot of different ways. One is fear of intense feelings that you may feel. So one thing that happens during trauma is that emotions are so raw that it feels scary how big and raw those emotions can be. So sometimes we may feel afraid of how intensely we feel in response to the trauma that we're hearing about. We may also be afraid of our own vulnerability. This can be extra common when it's a common crisis that's occurring. I know this happened so much during COVID too, that we would hear about other people's experience losing jobs or having family members get COVID or getting COVID ourselves. It was something that everyone was experiencing. So hearing about other people's experiences made it very easy to be afraid of personal vulnerability. But it doesn't have to be something that's a worldwide event. It could be something that you may never experience, but hearing about it makes you feel more afraid that it could happen to you. The important thing here is to identify our fear and make those connections about what's fueling it. So you may feel fear that feels disconnected from what you heard about. So you may hear about someone getting attacked on the subway and then be really afraid about your safety walking home from work. It may be disconnected, and you may have a hard time making that connection between one thing and the other. But hearing about others' fear just increases the sensitivity of our nervous system to you. So it increases your body's ability to feel fear in situations where you might not have felt fear before. Why is it so hard to connect with our fear? Depends on the person, but one reason why is that it makes us feel vulnerable. And we're dealing with families who are vulnerable and vulnerability in general if you're dealing with trauma. So seeing what someone else is experiencing makes it really hard to admit that you're also feeling fear as a result. Makes us feel like we could have more in common with the people in front of us than we realize. And that scares us because they've experienced trauma and no one wants to experience trauma. Sometimes we might also worry that it could overwhelm us and then make it harder to do the work. That if we truly feel all of the fear that we're experiencing, that it could be too much emotionally and make us incapable of connecting to our work. But in reality, when we hold it in, we don't access it or get in touch with it, that's when we're more likely to be overwhelmed. So instead, some of the things we can do are embracing the preciousness of life, really like celebrating the things that we see that are a precious indication of life, and choose to be loving and compassionate to others and ourselves. So part of that looks like when you're having fear, to respond to it kind of like you would if someone you really cared about was experiencing fear. Be kind to yourself, be caring, give yourself what you need to feel safe. Instead of, sometimes we might say, like, there's no reason to feel fear, keep going. You didn't experience that. So those thoughts are not what you would tell someone else necessarily. So we want to, we'll talk more about that self-compassion in a second too. The other emotion that we might feel in the face of trauma is anger, and then secondary cynicism. So anger can come up for a lot of different ways when we've seen other people's trauma, but sometimes it's just a reaction to our nervous systems being really on guard. This is a quote from someone who worked in child protective services, that I have all this anger bottled up inside me and I feel like I can't let it out. I wouldn't know what to do with it, and I feel like it'd be too much. So it's just inside of me and I can't hold it anymore. So we can develop anger for a wide variety of reasons. And some of it comes from this anger that things are unfair for the people who've experienced trauma, that they shouldn't have had to experience it, but they did. Anger is a hard one for us to acknowledge that we're experiencing. And so anger is one of those that we do often tend to bottle up more, but it comes out in other ways. Like we talked about, that anger and irritability can sometimes be a way that we can see that we're experiencing secondary trauma. So the question or the things that we want to think about are whether you know what your anger feels and looks like. Um, do you know what it looks and feels like to other people? Do you know what's at the root of it? What is it that's driving you to be angry? Or does it feel like it's little things? A lot of times when little things are making us angry, there's something else at the root of it that we're not in touch with. And anger becomes misdirected at those little things when we don't acknowledge it and we try to hold it in. Cynicism is also a form of anger, but it can warp our sense of the world around us. So cynically thinking like the worst of every situation, thinking things will never get better, is this feeling of anger at the world for being the way that it is, or for allowing these situations to happen to the people that we're working with or us. Number 14 is an inability to empathize or a numbing feeling. So what that looks like is it's like you're a sponge that's completely saturated and has never been wrung out. So you can only take in so much. You can only take in so much hearing what other people tell you about their trauma before your body can't take in anymore. So we just numb it in different ways. Either we respond to people, if you've ever worked with a physician or someone who responds very straight-faced to everything, sometimes that's because they've learned how to numb their response, because if they feel all of what they're seeing, they might never be able to pick themselves up off the ground. We also live in a society, often work for agencies with a lot of mechanisms that encourage numbing. Societally, sometimes substances encourage numbing. Caffeine can encourage it, but also overworking and overscheduling yourself so that you're so busy with other things that you don't have time to notice what's going on in your body. And then we confuse being amped up, attending to crises, and having a sense of being needed with being effective. So we're so going in this hurry for the sake of hurry and feeling like everything is a crisis that we don't really attend to what we're experiencing. And then that can lead to addictions. Sometimes addictions are for the purpose of numbing, but sometimes not. So there's this just attachment that's so strong that it persists despite our understanding that it is potentially destructive. So when we think of addiction, sometimes we think of obviously substances, but there are other things. So things like overwork, like I mentioned in the last one. So some of the questions that it give us to think about that is, what are we most attached to? What do we count on to help us numb? And what would I be really resistant to giving up in my life because I need it to get through my day? Those things might be effective in the short term, but over time we need more and more of them to numb us out. So you might have to work more and more hours to feel like you're getting something done. And at some point, the barrier against feeling our emotions ruptures, and then in comes everything we've been trying to avoid, but we haven't been practicing skills to manage it because we've been using these strategies instead. Number 16 kind of takes a shift here and is called grandiosity. So the idea here is that work is the center of our identity. So that may mean that we stay at a job for longer than it's actually good for us, for longer than we're getting something out of it. We might think, who else will do it if I'm not here? Like we talked about at the beginning, and then I can't leave. They're relying on me. There's this feeling like you might be stuck. So here our goal is we really need to acknowledge that we get value from what we do without making it all about what we do. Because then if you feel this reaction or emotionally like this is too much for me, it's a lot harder to step away if your whole identity is wrapped up in that. So ideally, our goal is to find other places outside of work where we can feel fulfilled and important rather than just the work. Friendships, volunteer work, hobbies, anything like that, but places where we can show how our lives are full rather than just from that one place. I'll be honest here, this was the one I had the most difficulty with when I read through this, but we'll talk through different strategies because I love what I do and I find it really fulfilling. Sometimes it becomes a lot of what I am. So we also like to acknowledge here that if you have personal trauma history, it can increase your risk for vicarious and secondary traumatization, largely sometimes because of intersecting identities. So if you have patients who've been through similar life experiences or even experienced similar more historical traumatization that you experience, it can be hard to disentangle and separate in those cases. Sometimes this can lead to over-identification with the patient. And then you can also be a therapist, psychologist, and also choose not to or work in any of the organizations that you're in and choose not to focus on trauma. I will say most of the organizations that we're in, you're going to experience some little t trauma, but it's also okay to acknowledge that this is a lot for me and I need to work in an area that doesn't include big T trauma. I also like to acknowledge that external factors within your organization are really going to impact the risk of secondary trauma. So things that can increase your risk are lower pay. It decreases the things that you can do outside of work. It also makes it harder to feel like you're not stuck there. If you're like, I need to work for paychecks, I can keep paying my rent. If you have a little bit of a buffer, you feel like you have a little bit more of a choice. The control that you have at work, what hours you work, what tasks you're assigned, all of that also gives you a little, or if you have less control over it, that makes it more likely you're going to experience secondary trauma. The workplace culture, I talked about this a little bit in terms of if you have a culture that encourages some of that mentality of overwork, overscheduling, working long hours, seeing the worst, having a hard time with creativity and flexibility, that's going to make the risk of secondary trauma a lot higher too. And your workload, which is similar to that control. There are things though that really can add resilience to that. So if you find that some of these are true of you, we can try to add in some of these to increase the resilience that you're experiencing. So one is having a diverse caseload, meaning if you work mostly with actual like families who've experienced a lot of trauma, is there a part of your workday that can even be not facing a person, working at your computer or doing a different task so that you're not absorbing and holding trauma all day long and you have time to reset your nervous system? Supportive supervision is also huge, finding like a mentor that you can talk to about when you have reactions to trauma. And then having peer support networks. where you don't even necessarily have to talk through the trauma that you've experienced, but just hearing from other people about their experiences can allow you to be hearing a wider variety of things during your day instead of just the experience, the like stressful little t trauma experiences. Other individual strategies include seeking individual counseling, processing how you process. And I say it like this because people process in different ways. So journaling is one way that helps some people. There's even a thought in that book that I talked about to go through and write down even like once a month out of those 16, like, do I feel like I'm feeling any of these? Because that awareness is a huge part of it. Mindfulness that we'll talk about even more in a little bit. And then spirituality is huge for some people too. And that's the way that they process what they've heard and what they're experiencing. Coping, how you cope. Again, that these are all personal ways that people find effective. So doing something physical is often super helpful for your body to reset your nervous systems, but that can look a lot of different ways. Some people that's going for a walk. Some people that's yoga. Some people that's just dancing at the end of the day. Doing something relaxing but engaging is also an important one. So that might be reading, doing a puzzle, cooking or baking. I've had people who find each one of these stressful and different people who find each one of these calming. So it really depends on who you are and what you find actually relaxing. Another thing that we really can do is find meaning when it feels like the world is uncaring. So when you start to have that feeling like you're questioning the world, yourself, others because of the trauma that you're hearing about, you can find ways to find meaning, and that can look different for everyone. One way some people find meaning is to volunteer, to renew your belief in the good of others. I started a nonprofit to find more meaning. So like there are many different ways that people find meaning, but it really requires that you kind of check in with yourself about where you see meaning and where you feel like meaning is missing so that you can look for it in those places where you feel like it might be missing. Sometimes it can help to just do something you find playful to renew a sense of joy. I like to play with my dogs. That's how I find play. Some people find play through dancing or singing. Some people go to karaoke and find play in that. So it really depends on you, what you're comfortable with, what you find playful, and do more of that. Use your sick and your vacation time also. If you're feeling not great mentally or emotionally, or mentally and or physically, and you have vacation or you have sick time, take your sick time because it's going to help you to be able to have space to reset your nervous system. The other thing that can help, especially in the face of such serious work that you're doing, is to do something that makes you laugh. Some people, that's just calling up a friend and talking about light topics. Some people like to listen to comedy. I like to go to comedy shows because it makes me laugh and I can't have my phone on during it. So it's a good way to disconnect too. So the book Trauma Stewardship gives us 5 directions to think about how to get in touch with those 16 things that we talked about, our symptoms of that secondary trauma. So the first one is to inquire more. So you have to create space for inquiry. This isn't sitting down for a second and being like, okay, let's get in touch with what's going on. Give yourself at least 10 minutes to ask yourself these questions, and it would help to ask yourself once a week or so. Why am I doing what I'm doing? Why are you doing the job that you're doing? Sometimes it helps to like write that down on a post-it, put it somewhere so that you can remind yourself. It might change next week. You can write a different one. Another question that's tough is to ask yourself, is this working for me? Is it working for me to work here? Is it working for me to work these hours? Is it working for me to work with patients, not with patients, with families who've experienced trauma, not with families who've experienced trauma? You may have made a decision when you started that job, but that doesn't mean that you can't change your decision. You may be able to change it even within your organization, but ask yourself, is it working for me? It's also okay if something used to work for you and it doesn't now. One thing that or one thought I thought might help start the question of why am I doing what I'm doing is thinking smaller. Like, what is it that gets you in your car in the morning? What is it that gets you up out of bed? Think through what is actually motivating you, and that can sometimes help you to remember your why. What gets you to sign into meetings with your team? What got you to sign in right now? And remember that arguably you always have a choice. There are things that feel mandatory or not optional, but you always have a choice to say no. There may be sometimes consequences about that, but reminding yourself, I could do this or I could not, gives you a little bit more of that space back to be the one who makes your decisions. So this is kind of what I had talked about, where you can write down what you're doing, keep it somewhere. I actually have a note on my phone that I add to every once in a while about these are the things that are why I do this job. And sometimes if I'm having a tough day or I feel like things are not going the way that I want to, or I'm feeling some of those like sense of persecution type thoughts, then I go back to it and read it. Trauma mastery is also something we want to keep an eye out for within the work that you're doing. If you've experienced anything, any historical wounds or trauma, big T or little t, sometimes that motivates us to do the work that we do. But sometimes it can also be a reason why it's harder to disentangle ourselves and the person in front of us because of our own experience. And that can be sometimes why we make it more personal than it is. So sometimes we'll recreate some situations similar to the traumatic incident because we felt powerless there. In a situation where we feel competent, like at work, where we can fix what went wrong the first time. So sometimes the way we talk about this in therapy with little kids is that there's a tendency for therapists to see patterns of parents and kids that recreate the way that their parents may have interacted with them. And there sometimes is a tendency to want to be extra invested in that relationship that reminds you of what happened when you were a child because you want to fix what happened when you were a child. But it's not your parent and you're not the kid. So the challenge here is to be able to be aware of when that's happening, to notice it. Ways that it comes up, it can come up at work, it can come up in relationships. So examples that came up were things like, I broke my leg running, so now I run as many marathons as I can to fix the time it didn't go well. Some people may marry someone like a parent to recreate the relationship they didn't have as a child. Someone who experienced abuse might volunteer at a domestic violence shelter. They may find that it's difficult to separate what was from what is. And then sometimes you might have difficult expectations for the people in front of you because of it. So like I mentioned, one of the big questions we want to ask is whether this is working for me. So ways that we can ask it is, does it work for me? How does it work for me? And why does it work for me? Does it work for me because I'm trying to fix that trauma experience I've experienced? Or does it work for me because it brings joy to my life? doing this work, like I said, might have been the best fit for you at some point, but as we evolved, it might not be, and that's okay. So one thing we can try is to maybe brainstorm 5 ways in which you think what you're doing is working for you, and then maybe take a step away, maybe go back to it, look at it, assess to what degree those ways are or are not in your best interest or the best interest of those you serve. And then you could create a list of 5 ways you would like to see the work benefit you and those you serve, and see how similar those 2 lists are. One thing that can help this work to work for many people is to find larger structures and movements that allow them to enjoy life while also doing the work. One example of that I actually found recently is it is really hard when we're entrenched in what we're doing on a day-to-day basis that may feel like you're moving very slowly in one direction. I actually went to like a conference about the treatment and the research that we do recently, and I felt like being involved in a group of people who were doing the same work, but I could see more widely how many people were doing the work and how much it meant to all of those people doing it was a way for me to get embedded in a larger structure. I think working within the Children's Trust, one of the things that we do is through our team coach at the University of Miami, we have communities of practice where we try to bring more people from different programs together. And personally, when I'm at them, I feel more like, wow, I'm getting to hear from everyone about all of the work that we're all doing in Miami and not just what I'm doing on a daily basis. It's a way of connecting to that larger structure of programs that's all trying to better the lives of families in the county. So finding things like that, some people find that in their faith or spiritual lives as well. So the next step, there's directions on here because the book paints it in terms of the directions, but it's really just kind of steps. The next one is choosing our focus. So what is the thing that you're focused on? Focusing on negative or painful or troubling events can be something that once you get in that pattern, you keep going. And it's hard to shift out of it. We can change our lives instead by reframing our experiences. So sometimes that means concentrating on what's in front of you right now. And sometimes that means stepping back to see the bigger picture. So one example is someone who worked in an ER who focused on what they were able to do that day, focused on what went well, what changed, what moved, because they couldn't focus on the larger picture of all of the people who needed help because it would overwhelm them. Resourcing is another strategy. So when you're feeling overwhelmed and it's hard to see the things in front of you that can give you energy, to instead call up a memory or image that brings you peaceful or joyful sensations. Sometimes it needs to be enough to focus on there being no immediate crisis in the moment. So once you've gotten over a crisis, focusing on the earth is not shaking, we're not in the middle of hurricane season, court is adjourned, no one's on fire, the grant application is done, we have a grant funding for the next 3 years. So focusing more on what is happening in this moment that I can hold on to as we're getting through these difficult times. To increase that sense of control too, you can think through, what is my plan B? So dream up a new vision for how you might plan your life. That might include a career change. It might just include a different approach to your current work. It might just include a different tasks at work. Can also help to just daydream and think, if I weren't doing this work, what would I love to do? And then you can decide is this still working for me, or would I rather pursue plan B? And that gives us a sense of, if you decide to keep doing the work you're doing, you made that choice. It's not because you were forced to do it. The next one is, we really want to make sure we have that support around us. So a microculture of support of friends and family, they should support us in a couple of ways. So you might not find this in the same people, but you want to have a culture around you that supports you with encouragement and holds you accountable for the things that you need to do, like going to work in some capacity. Think about the members of your microculture. To what degree do they bring on hopefulness, accountability, integrity? Could you use different role models in those areas? This one is huge in a lot of those areas of secondary trauma, that if your compassion that you experience doesn't include yourself, it's not complete. That if you don't practice being compassionate towards yourself, then it'll be much harder to be compassionate towards others. That can include actually practicing like mindfulness, self-compassion, but it can also just be, if you miss a deadline, you may think, oh, I'm so stupid. What could you think instead? Like, oh no, you're so overwhelmed. That may be a different way of feeling compassionate for yourself. Compassion is often easy for those who are sympathetic. So giving compassion is easy for people who like have experienced the trauma or are victims or survivors of the trauma. But it's less easy for those who hurt us, yell at us, or argue with us. It's hard to be compassionate towards those people because our energy is precious. So remember that being compassionate for others doesn't mean condoning their behavior or having low expectations of them or ourselves, but it just means remembering that the situation is more complex than it looks. I'm going to go a little quicker because I see we're running out of time. Another hugely important part is to engage with our lives outside of work. Sometimes this means during your workday, but also outside of your workday. So during the day, try to reclaim moments to attend to your inner well-being. That might mean taking 3 minutes between meetings to breathe and focus on your breath. That might mean listening to music on the ride between site visits instead of the news. That might mean a patient cancels, and instead of scrolling social media, you call a friend. Sometimes that just means using the bathroom when you actually need to during the day, or eating something instead of not doing that. Remember that your work is only feasible in its best form if you are also taken care of. So try to negotiate your hours or schedule, surround yourself with colleagues that will support you as you stick to those boundaries too. It can also be helpful to model taking time off when sick. So not coming in when you're actively like coughing and sneezing, so that other people see we take time off when our bodies tell us we need it. Leave your phone and email unattended when you're on vacation or on the weekend. And try to avoid sending emails at off hours. You can schedule them if you're working at off hours, but then it shows colleagues that you're not available during those hours and you don't expect them to be available either. I know I work better if I can have a chunk of time to work, but I don't want other people to contact me during that time because then my work will be interrupted. So I schedule those emails so that it does not feel like I'm available because I don't want to be. Other things about engaging with life outside of work, try to think about one thing that you'd love to incorporate in that work day, but you're sure it wouldn't be possible. But think about what's standing in the way. Gratitude is another huge one. And this plays into kind of that glass half full, half empty dynamic that we can try to notice more of the things that maybe feel relieving or also positive in our day, that we can try to draw our attention to those things instead of the things that will naturally draw our attention because they bring out strong, scary feelings like that fear, guilt, anger. So some of the ways that this can look are creating systems in the workplace that create opportunities for workers or employees to praise and thank one another. For our team, at the beginning of every meeting, we have good news and we just share about positive things that other people did during the week. That's a great way to start spreading gratitude. You can, at the beginning and end of your workday, you could create a ritual of taking a moment to think about one thing you're grateful for. Every single day, you can try to think of one person you're grateful to and tell that person. And it can be something small. Create a daily practice is huge too. So thinking about at the beginning of your day, what do you want for the next hour, day, next meeting? That might be, I want to get through the day and have energy at the end of the day. I want to find something to be grateful for today. I want to take a deep breath at the beginning and end of the meeting to center myself. Try to find moments when you can cultivate little moments of mindfulness. You can create reminders for yourself to start, reminders on your phone at the end of each meeting, bringing your attention towards the present in those moments. I've actually started to, I have an app on my phone that's free that's called Insight Timer that I use when I'm in a waiting room. I don't close my eyes because I'm worried people think I'm asleep, but you can just look down and do the same exercises. And instead of being on my phone in a waiting room, I'll sit and try to take deep breaths. And it's kind of just a natural moment for me to center myself. Skip that for a second. One thing to think about is that these are all things we want to do preventatively. You may find that you're like, I'm not at prevention, I'm at addressing this. Or you may not realize it. So you may find that you don't notice when you need to take care of yourself more because you're so in the work that other people maybe notice. So if you don't notice, who does? You might notice that people will say things like, "Are you okay? I haven't seen you in a while. I just wanted to check in on you." That's a sign that something's different. And if you do notice, how do you notice you need more self-care? And then when we think about the things that you might do to take care of yourself, what might you need in an ideal world to be able to do that? Some people might say a 3-hour workday, right? So there are things in an ideal world that might exist that you feel like you might need. If those things are not possible, why? And then I have just some ways that sometimes we realize we need more self-care without really realizing that these things are indications of it, like spending more time on social media. You might plan out an activity you want to do and then just kind of never get to it. You might have trouble staying asleep or falling asleep or sleeping a lot more. You might be hungry for more junk food than usual, like more sugary things, because that's a way of our bodies saying, like, I've got a lot of stress going on. You might have other like random body aches and pains that are happening more than usual. But we've talked about a lot of the other ones. So I'm going to stop sharing. I know I have like 5 minutes left, but I do want to see if anyone has any questions because I know that's a lot of information.
I think you didn't leave everything uncovered. When I had a question, you already addressed it or you passed
Right.
it. I was like, oh my gosh, and I think you describe in detail every single day of our lives because all of us here have to deal with this kind of situations, families, and many times the feelings are so diverse. Like sometimes you're
Mhm.
just frustrated with the system.
Yep.
Sometimes you're just sad and you end up crying. Sometimes you have to talk to someone like, what can we do? Like, like hopeless or so it takes all the points. I honestly, personally, there's nothing that I can add to all the things that you described. And I know, for example, like I know Lourdes has been doing this for a very long time. And I always ask her, like, how do you do it for
Mhm.
many, many years with that passion, that love, that beauty, like, and it has to do with all the things that you were saying. So I don't know if Lourdes, you were practicing this and you've been doing it, but I think you really give us a powerful information on how to manage and how to move forward.
I
Yes?
mean, it just, yeah. I mean, I dealt with so many families and everything. What everything she was talking about. I mean, I felt it before
You
and
did
things,
it, yes.
but you do have to find ways how to deal with that, finding strategies because being here for 41 years, you gotta find ways to to survive, but you do. You can't, I mean, I can identify some of the things you were saying. But the thing is, we have a very good work culture here, so we're very supportive to each other, and we help each other. And if one is going through a difficult time, we step in and we help our co-workers. So we're very good about, of course, our social service team is always helping our staff. So to identify these things and so that's that thing that I can say about our workplace. It's very supportive, very supportive. And we have to be because we work with people every single day with their problems, and in order to do this job, we have to be helping each other.
For
So
any length of
yeah.
time. Yeah. Yeah. Especially 41 years. Oh my gosh.
41 years.
Well, I
Right.
mentioned you. It was, and it's always with that smile, with that energy, with that. It's like, wow, okay, we're gonna
Oh,
learn
thank you.
something here.
And it is a fun place to be at, okay? Let me tell you that,
I
okay? So
know.
we do laugh, we cry, we share things here. I
Yeah. And
think
that playfulness is a huge part of it too.
that's
Like,
yes,
finding that
and
out from
oh
kids.
yes, and we and our social service team, we have people. I'm in my office, and I hear them laughing. I'm going over there. Okay, what happened? And they're always
I want a part of
Reggie's there.
that.
Reggie knows what I'm talking about. They're always
Yeah.
joking around, which is important.
Yeah, that's awesome.
But I don't know if anyone else has any other question. I think this is a very powerful moment. And again, like you brings us in detail to review a lot of things that I personally didn't think before, like in so detail. And it's okay. Well, no, we gotta stop, take a deep breath, think through it, and then recharge, and then keep on doing it. Because I think if we are doing this job, is because we care. We really
Yeah.
do, and all of us, we love what we do.
Mhm.
But we need to remember all those things that you mentioned today. I'm so grateful to have heard it from you, and we really appreciate it. And
Well, thank you. I want to say thank you too. You were very detailed with everything, and thank you for taking the time to do this for us. We
Yeah.
yes, thank you
appreciate it.
so much.
It's
Thank
so
you.
important. This is something that affects everyone working in this population, whether they realize it or not. And it's just so important for them to hear from someone that, like, yeah, it's a thing and it's not you, it's the work that you're doing. So um I'm glad that you are spreading the word about it too.
Yes, we thank you so much, Dr. Peskin. We're privileged and blessed to have you today with us. We have the recording that we're gonna share in our channel for the other folks and community partners that weren't able to attend at this time. But definitely we're gonna keep contributing to the maintenance of this important work that we do for our community.
Awesome. Yeah, thanks for having me.
Thank you so much. Thank you everyone for attending. We'll see you next time.
Bye.
Thank you.
Bye.